Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Townsend Letter, the Examiner of Alternative Medicine, is a print and e-magazine that is published 10 times yearly. Founded in 1983, the newsletter has expanded to a journal discussing diagnosis and treatment used in naturopathy, natural medicine, herbal therapies, and integrative medicine. Visit townsendletter.com. The Townsend Letter proudly supports the LDN conferences. Today my guest is Dr. Jonathan Collin, who's an MD who prescribes LDN, and he also is the publisher of the Townsend Letter. Thank you for joining us today, Jonathan.
Thank you.
Could you give us some details about yourself? What made you decide to get into medicine?
Originally, I had an interest particularly in engineering and basic sciences. There was a thought, this was back in the 70s, of pursuing postgraduate work in biomedical engineering. And in looking at doing that, I thought that the best route would be to proceed through medical school. And so I did pursue that medical school education with the thought that then I would do postgraduate studies in engineering, but I decided in the middle of all that to focus in on internal medicine instead, and I let go of that interest in the scientific education in engineering, biomedical engineering. And then my focus switched to a more specific interest into dermatology, but along the route of looking at this, I became involved with quite a few individuals who were bringing up alternative ideas on how healing was taking place, and I was kind of surprised that in medical school education we didn't really look at these alternative areas. We were very conventional in terms of looking at surgery and drug therapies. I became particularly interested in mental health and how mental health was very much a strategy in the late 70s of approaching a patient with drug therapies that, particularly in dealing with patients with psychosis, were limited in their benefits. And there were definitely practitioners who talked about the need to investigate these patients from a nutritional viewpoint. And that did lead me to looking at, we could use the word alternative medicine or integrative medicine, way back in the early 80s. And I decided to let go of pursuing internal medicine and dermatology and instead started focusing in on this area of integrative medicine and combining that with a general medicine practice.
Mm-hmm.
At the same time, in the early 1980s, I became involved with the idea that practitioners were not able to get themselves any type of forum to share their ideas of what this integrated medicine was involved. Of course, this was back in the days prior to the internet. Medical journals weren't really interested in having articles on integrative medicine. And so practitioners were very limited. They would arrange congresses or symposiums or medical meetings, and it usually were practitioners scattered across different states or even different countries. Made it very difficult to share ideas. And at that point, having had a involvement with, well, if we want to go all the way back to the high school newspaper, as well as the college engineering magazine at Cornell, I knew that I could take on the ability to create a magazine that would act as a forum for practitioners. And so we got involved with starting originally a newsletter, which became a magazine. It's called the Townsend Letter. And at that time in the early 1980s, we were, so to speak, the only show in town for doctors sharing information. And it was a very active publication in the early to late 80s because there was nothing else that was available. And so that was a very exciting beginning to work in integrative medicine for myself. Another thing that I got involved with was the Congress in the United States were getting badgered in the early 1980s with lots of patients who were looking for alternative cancer treatments, and they were wanting an investigation by Congress as to what this was all about. And so I got involved in the early 1980s with the Congress to do an investigation of alternative cancer treatments, and the result of that was a report that came out in 1990 that ultimately led to the National Institutes of Health creating an Office of Alternative Medicine, and several years later that became the Center for Complementary and Alternative Medicine at the National Institutes of Health. I was no longer involved with that office, but I was very happy that our study led to that office being created at the NIH.
Mm-hmm. Wow.
So the Townsend Letter has served as a forum for doctors, and of course patients have used it as a reading source as well, and this has continued now for well over 30 years. My own practice, I can't say that I do everything that's in the Townsend Letter, but there are many things I'm involved with personally in terms of offering patients integrative types of treatments that move beyond the drug therapies and surgery to consider herbal medicine, therapies of vitamin and nutritional medicine, homeopathy, which has actually been something that has been ongoing for almost 200 years, although I know that it's facing a lot of controversy around the world. My own experience of homeopathy is that it frequently is very helpful for many patients, despite the criticism of many skeptics. And in the last decade, I've had exposure and use with the Low Dose Naltrexone, which has been something that a number of my patients have found useful in support of autoimmune conditions and inflammation. And also the naltrexone itself, when it's not used in low dose, I've been involved with in terms of its treatment support for alcoholism.
Or as it's now called, is alcohol use disorder. I think it was
alcohol use disorder.
Yes. Mm-hmm.
It certainly is something that has been a remarkably effective treatment. I've had many individuals who have used this technique. It's also been given the label, the Sinclair Method, or TSM. The treatment, in many ways, is extremely simplistic. It is totally different from the approach that requires the individual to depend on willpower, like an approach using Alcoholics Anonymous. There is no requirement for the individual to use willpower. The medication naltrexone is prescribed, and it is taken 1 hour prior to drinking, and there is a slow deconditioning process that makes the individual feel less craving for drinking the typical amount of alcohol that they're consuming. And as time goes on, that extinguishing behavior continues, so that if a person was using a large amount of alcohol on a daily basis in the course of events with no unusual willpower by the patient, they will find themselves drinking progressively less and less alcohol on a daily basis. And the medication naltrexone has minimal adverse effects. There are some individuals who might have some GI symptoms or headaches to begin with, but those symptoms are usually extremely mild and go away in a matter of days or weeks. But the end result is that many individuals who are having a very, very difficult time with uncontrollable alcoholism and a lack of success with using other alcohol detox techniques or AA methods, they can come into this kind of approach and gradually over 3 to 6 months find their alcoholism or alcohol dependency brought under control. And it is very unusual in that it's not required that the person is abstinent or has an end goal of abstinence. That could be the goal, but the goal could also be simply to get to the place where the person can drink 1 to 2 drinks at night and not have binging behavior.
Mm-hmm.
So I'm very happy with the Sinclair Method because it is something that is quite successful.
Mm-hmm. So if a patient came to see you who was suffering from alcohol use disorder, would you automatically prescribe LDN? Would you do any tests on them or counsel them beforehand? How is your approach? What is your approach?
Well, unfortunately, the individual has a history of alcohol use disorder, has been sustaining damage to their liver over an extended period of time and to other organs in their body. And so it's always useful for that person to have a medical exam and to do your basic laboratory test. And usually when they come in, they have other issues at the same time. And because I am involved in integrative medicine, I do consider those other problems at the same time I'm working with this treatment method. So we certainly don't want to use the naltrexone if the person is having hepatitis or liver failure, or if they have major kidney function abnormalities. If they're pregnant, there can be other circumstances that would limit the use of the naltrexone. But at the same token, we do know that a person who is seriously drinking alcohol daily is potentially making their liver go into a serious disease state with likely cirrhosis as the end result. So the decision as to not use naltrexone versus using it due to some other risk factors has to always be weighed. I would say that because the worry with ongoing heavy alcohol intake is such a risk for the liver, some of those risk factors should be mitigated against and not worried that it may do this or may do that we want to proceed on trying the Sinclair method anyway, because the end result of a person who has either become abstinent or has gotten to a place where their alcohol consumption is one drink a night or something of that sort is worth the effort.
Mm-hmm. For those people who probably haven't heard of the Sinclair method before, you're talking about a 50 milligram tablet to be taken an hour before alcohol. So if you had a patient who wakes up in the morning shaking because they need a drink and they drink throughout the day, how would you get them to take the tablet an hour before? How long does that tablet last before they need to take another one?
Well, that's a situation which I can say I don't run into very often. I don't have too many clients of that sort. You're giving me a situation where the person is probably needing additional support beyond this treatment method. I would bring in my integrative medicine and probably be using high doses of B vitamins and certain amino acids to try to restore some normalcy to what this person is like, in addition to using naltrexone. I would not depend on naltrexone alone to approach that type of situation. Mm-hmm. Unfortunately, many individuals who are in a situation that is as difficult as what you're describing don't have necessarily sufficient motivation to stay with a program like this. So it does require a certain amount of agreement on the individual's own determinism that they want to really work on their alcoholism. And if they're non-committal to doing this and they're in the shape you're describing, I would imagine it's going to be very difficult.
Mm-hmm. So do your patients normally only take the naltrexone once a day?
Yes.
Okay. Mm-hmm. And you were saying around about the 6-month mark, they should maybe be into the place that they would like to be, either not drinking at all or just having one or two. Would you say that is the outcome for most of your patients?
I would say yes. Unfortunately, it's like many other situations. Sometimes follow-up is not as good as one would like, and certain individuals will achieve a certain level of what they would consider to be success in what they're doing, and I lose track of them. So I have to face the same situation that many other practitioners have, that patients make decisions as to what they're willing to do and what they're not willing to do. The ones who have been most successful, as you say, have continued doing this for 6 months and have reached a place that they're content in what they've achieved. A remarkable aspect of this program is, let us say that the person is not drinking the majority of time, but will, on this occasion, there's a party and they decide that they do want to drink. They have not been using naltrexone because they've not been drinking, and that's the other aspect of this, is that if they're not drinking on a particular day, you don't use the naltrexone. You only use the naltrexone if you are drinking that day. So if you have this person who's gone through the program and they have successfully become abstinent, but they decide on a particular day to there's a party and they will be drinking, they must, at that point, after not using naltrexone for quite a while, now go ahead and use the naltrexone on that particular day 1 hour prior to drinking. Mm-hmm. So one of the things that is part of this program, which is very important, is that if the person, after having gone through the program for some time, begins to drink again without using the naltrexone, they may unravel all the benefits that they have previously gotten.
Mm-hmm. Well, I've spoken to several people who have been through the program where they had the craving for alcohol prior to taking the 50 milligram tablets. And once they started, it was such a relief for them not to have to stop. Where, like you were saying about Alcoholics Anonymous, where it's really frowned upon if you drink at all. So having that option to continue drinking an hour after your 50 milligram tablet of naltrexone, people have told me that even straight away they haven't wanted the volume that they had before, and where normally they would open can after can of beer, let's say, and they had to hold it in their hand. They actually then got so they could put it down, put the can down, and actually go and do something else, and then come back and think, oh, I haven't finished this can of beer.
Right.
And for those people, that is just life-changing. It's retraining your brain, isn't it? Your thought patterns, and the desire to drink just goes. And these people are just so amazed not to have that dependency. You know, because it ruins your life when all you are looking for is to have the next drink. And of course,
absolutely right.
Naltrexone, the 50 milligrams isn't low dose naltrexone, but it is a different way of using it than what was originally designed for. But it is so cheap, isn't it? And people don't have to deny themselves the alcohol because their body stops craving it. And it just seems like a win-win, doesn't it? And would you say there are many doctors out there who are using the Sinclair Method now?
You know, I don't know what is occurring in the UK, but in the United States, unfortunately, it is a very tiny percentage of doctors who are using this. And a number of people have asked me this, and I have no real answer for this. I just know that if you compare this to this whole business with the opioid epidemic and the use of these rehab programs that use opioid blockers like the Suboxone treatments, there are many, many physicians who do the Suboxone treatments, but if you look at the physicians or other health practitioners who are using the Sinclair Method, naltrexone for alcoholism, it is an extremely tiny number of physicians who are doing this. And I have no explanation for why that is the case. I guess the only thing I can come up with is that there seems to be some sort of cognitive block that we're going to do an alcohol treatment on a person, and it's required that you keep drinking alcohol to do it.
Mm-hmm.
That might be a sort of such a cognitive dissonance for doctors that they don't want to be involved.
Can I ask you a question now, Jonathan? Have you actually had an article on the Sinclair Method in the Townsend Letter?
We only have had partial references to it in the magazine and maybe little paragraph sections. We have not had a full article at this point in the Townsend Letter on the Sinclair Method.
Well, maybe that's food for thought.
We have had it on the LDN, the use of low dose naltrexone for various different conditions, but we've not had the Sinclair Method, unfortunately.
Mm. Well, maybe that's something you could focus on later in the year.
Yes.
Because having seen your magazine, and I read it monthly, you are, like you said, educating other doctors, and I think maybe the tool that you have already there to educate doctors would be a way of making the Sinclair Method really take off.
Absolutely.
Because, of course,
very good suggestion.
It's not only in print, you also have it so people can download it online. So location doesn't really matter, does it? Whether you're in England, America, Canada, Australia, it's accessible to everybody.
Right. If you go on the Townsend Letter, that's like Townsend Letter, Townsend Letter website, you will see the contents of the May issue, and the contents have several articles that are hyperlinked, and there's no charge for looking at that. So any individual can go to the website and go on the May issue, and the May issue focuses on cardiovascular disease, and there's a very nice article on high blood pressure. There's a nice article there on anticoagulant therapies as an alternative to the drug treatments. There's a nice article on the use of berberine as an herb that can have many uses. There's an article on testosterone as a support for cardiovascular disease. So individuals listening to this can definitely go to the Townsend website and Townsend Letter website and find things that I think would be of interest to read.
Well, I'm sure they will. And of course, when we have the conferences, you very kindly provide us with some magazines to hand out. But I know that there are many people who I've tried to offer one to who say they already subscribe to it. So I know you have an amazing following and you do a fantastic job. And it's been wonderful having you here today, talking about your experience as a doctor and about the Sinclair Method. And once again, if people want to go to your website, it's townsendletter.com. And thank you for being with us.
Thank you so much. I appreciate it, Wanda.
Townsend Letter, the Examiner of Alternative Medicine, is a print and e-magazine that is published 10 times yearly. Founded in 1983, the newsletter has expanded to a journal discussing diagnosis and treatment used in naturopathy, natural medicine, herbal therapies, and integrative medicine. Visit townsendletter.com. The Townsend Letter proudly supports the LDN conferences. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.